My name is Dr. Padam Nair, and I am a respiratory physician at McMaster University in Hamilton, Canada. I look after patients with severe airway diseases such as asthma and COPD. I have been frustrated that bronchitis, that is an essential component of these diseases, is not measured, and therefore the treatment of these diseases is not optimal. Therefore, along with my colleague, the late Professor Freddie Hargreave, we came up with a method to measure bronchitis using quantitative cell counts in sputum. The problem with this method is that it requires a laboratory, it is a bit time-consuming and tedious, and therefore it is not widely employed. In this proposal, we have come up with a very simple method to measure bronchitis quantitatively using a paper-based biosensor. We have come up with a method to incorporate an eosinophil-specific protein that we have identified that we will put on a paper. The method we have used is to create a special ink that we will incorporate into a cartridge that will then be put into a printer, which will enable this protein to be printed on ordinary paper. We also propose to include specific bacterial DNA onto the same paper that patients, when they have a bronchitis, would simply have to dip this paper into their sputum, and based on a quantitative color change, they would be able to adjust the dose of the inhaled corticosteroids or antibiotics and thereby improve the quality of care of their diseases. This frugal innovation, we hope, will change the way airway diseases are managed globally, both in resource-poor and resource-high countries, in both children and in adults.